Have you ever wondered who keeps the patient alive, pain free, and stable during surgery? It's not the surgeon, but the anesthetist or anesthesiology. Now, I'm going to tell you why I chose anesthesia and why it is considered one of the underestimated medical specialty across the globe. Hi guys, welcome to my channel. If you're new here, hi, my name is Dr. Grace and I talk about medicine, lifestyle and everything in between. So let's get right into this video. So anesthesia is not just about putting people to sleep. It's about controlling pain, monitoring vital organ function and making sure that the patient is stable throughout surgery, making sure the patient comes out alive throughout surgery. From the moment the patient enters the theater to the moment the patient comes out from the theater, that is all anesthesia. Why do I love anesthesia? Number one, I love critical care. Critical care is all about very intense monitoring of the vital organs of the body, the heart rates, the respiratory rates, the patient's temperature, vital organs and vital signs, making sure the patient is breathing well, making sure there is no heart failure, no lung collapse, no hypertension or hypotension during surgery. It's all about intense monitoring to keep the patient alive. Anesthesia is so intense. One small change can make a whole difference during the surgery or during a critical procedure. If you like working under tension or under pressure and you can be calm while at it, anesthesia is surely for you. The second reason why I like anesthesia is because the impact is immediate. It is not delayed. If a patient is undergoing pain, you have pain relief, which is an immediate action. You see the effects of the pain relief working, and the patient is now having a painless day or procedure. If the patient is not stable, you stabilize the patient. If the patient is not breathing well, you give medications to improve breathing rates and respiratory rates. If the patient is going through anything, whatever you're doing at that time as the anesthetist is an immediate treatment to give an immediate result. That is why I love anesthesia. The third reason why I love anesthesia is it's a behind the scenes power role. So if you're that person that doesn't really care about accolades and you just want the patient to be fine, trust me, you are the man or the woman for the job. You may not always be the spotlight like the surgeons because your work is basically to see the patient go through a pain-free, painless, stable surgery. And where else are you going to see the patient again after the surgery? Even if you see the patient post op care happens the day of the surgery. After then, you are never going to see the patient again. So the patient and the patient relatives might not even give you the accolades that you deserve. But if you don't care about accolades, trust me, that work is for you. The first reason why I appreciate anesthesia is variety and flexibility. So, as the anesthesiologist or anesthetist, you don't necessarily just have to be in the theater. So, you'll be in the theater some days, you'll be in the intensive care unit, that's the ICU. You can also be at emergency care, and you can also be in pain management clinic. So these are four different places I just mentioned that the anesthesiologist can work in. Now, the fact that I don't have to go through the same routine every day makes it very flexible and gives me a variety of things to do. So I know that I'm not working the same routine every single day, which makes anesthesia quite interesting. The fifth one, and I feel like this should be number one, is a structured work-life balance. Unlike other specialties, anesthesia is very structured. A day before the surgery, you know how many cases you have. For example, if today is Monday, before Tuesday, you know that you have probably 3 to 4 cases that you're going to be handling the next day. So you know that after the first case, you're literally going home unless you are on call. But even if you're on call, you can tell to some extent how many cases you're going to have before your call starts. So once you're done with that, you go home and you rest. Once you are done with any case, you are not taking any patient load back home. You're literally done for the day. Let's be honest, anesthesia is not all smooth. It's not all filled with a bed of roses. The truth of the matter is that as an anesthesiologist or an anesthetist, you actually have a high responsibility in the fact that the most of the things you do are procedures, and the procedures they have to do with medications. So you have to like check the dosing twice, be sure that this is the particular medication you want to do, and make sure that the dose, especially for children, are right. So any little mistake can change a lot in anesthesia, and it can cause mortality, which is very, very easy with overdosing in anesthesia. So trust me, it's not as smooth as people make it look. It's not a specialty for rest or to avoid tedious work. But trust me, if you thrive under pressure, you'll be fine. So, who and who should consider anesthesiology as a specialty? If you like physiology and pharmacology, you are going to do so well in anesthesia and anesthesiology. Remember, most procedures are with medications, which pharmacology comes in. You have to know the mechanism of action, what the drug does to the body, and what the body does to the drugs. You have to understand physiology because fluids, body fluid compartments, all the fluids, including blood, dextrose saline, dextrose water, Ringer's lactate, normal saline. You need to know when to choose those particular fluids, the dose, the amount needed for the body, and everything pharmacology, everything physiology is in anesthesia. If you are somebody that can work under pressure, anesthesia is definitely for you. Well, working under pressure is one thing, but being calm while working under pressure is the most important point I need to actually say while choosing anesthesia. If you enjoy hands-on procedures like setting of intravenous lines, setting of central lines, hanging fluids, hanging blood for patients, anything that has to be procedures, trust me, if you do enjoy all these things, anesthesia is definitely for you. If you don't need the need to have a constant recognition for anything good that you have done, anesthesia is definitely for you. If you remember a few minutes ago, I said that the surgeons are the one that gets most of the recognition because you don't really know the patient. So if you don't mind, trust me, anesthesia is for you. If you're considering choosing a medical specialty, please do not overlook or underestimate anesthesia. You need to actually do your research and check and know if this anesthesia is going to be something that you think you might want to consider doing as a specialty. If you enjoyed this video, don't forget to like, comment, share, and if you want to choose a medical specialty, please let me know which one comes to mind. If it is anesthesia, pediatrics, surgery, obstetrics and gynecology, emergency medicine, oncology, there are so many specialties to check from. If you are choosing any of these, just let me know, and then I'll see you in my next video. Bye for now.